Okay, so today I'm going to be talking about the pharynx. Very quickly, I wanted to start with the subdivisions of the pharynx. First, most superior is the nasal pharynx. It is superior to the soft palate. Inferior to that, we have the oral pharynx, which is essentially found at the posterior opening of the oral cavity. Specifically, it's found at the oropharyngeal isthmus. And more inferior to that, we have the laryngeal pharynx, which is the opening of the superior aperture of the larynx, or the laryngeal inlet. So essentially, the innervation of the pharynx, the motor and sensory innervation mainly comes from branches of the vagus nerve, which is cranial nerve 10, as well as the glossopharyngeal nerve, which is cranial nerve 9. And this is except for the nasal pharynx. And then the rest of the innervation comes from the maxillary nerve. So to be more concise, it's actually the pharyngeal nervous plexus which innervates it, and it innervates from the three main cranial nerves: the vagus nerve, cranial nerve 10, glossopharyngeal nerve, cranial nerve 9, and the maxillary nerve, which is the second branch of the trigeminal nerve. And so these pharyngeal branches of the vagus nerve are going to provide motor innervation to all of the structures of and muscles of the pharynx, except for the stylopharyngees, which is essentially receiving motor innervation from the glossopharyngeal nerve. In addition to the pharyngeal branches of the glossopharyngeal nerve, the majority of the sensory innervation is also being provided by the glossopharyngeal nerve. The exception to this, as I said before, is the nasal pharynx, and its anterior and superior parts are essentially supplied by the maxillary nerve, which is the second branch of the trigeminal, and the maxillary nerve is essentially providing sensory innervation to the nasal pharynx in the anterior and superior parts. So yeah, just to summarize, the major motor nerves of the pharynx are being mostly supplied by the vagus nerve, and the superior laryngeal branch of the vagus nerve is the external laryngeal nerve, and it supplies the inferior constrictor muscle of the pharynx. And then the pharyngeal branches of the glossopharyngeal nerve, which is a cranial nerve 9, is going to supply motor innervation to the stylopharynges. So that kind of summarizes the pharynx. Next, I wanted to talk specifically about the glossopharyngeal. So as I said before, the pharyngeal plexus is the main nervous plexus supplying the pharynx, and most of the sensory branches are coming off of the glossopharyngeal nerve, which is our cranial nerve 9, and a small amount are coming from our maxillary nerve. And this is again going to supply anterior and superior nasal pharynx, while the tonsillar nerve fibers are essentially being supplied by the glossopharyngeal nerve and the vagus nerve. And so essentially all of the muscles of the walls of the pharynx, which include the superior pharyngeal constrictor, the middle pharyngeal constrictor, the inferior pharyngeal constrictor, the palatopharyngeus, and the salpingopharyngeus, and the stylopharyngeus, are all being innervated by the vagus nerve, except for the stylopharyngeus, which is innervated by the glossopharyngeal nerve. And they all act on the pharynx by either constricting it or elevating it. Next, I wanted to talk a little bit about the arterial supply of the nasal aperture, or really the nasal cavity, not just the aperture. And I wanted to describe the arterial supply. So I'm going to start off with the branches of the external carotid artery, which are the sphenopalatine artery, the superior labial artery, and the lateral nasal artery. Then you have the branches of the internal carotid artery, which are the anterior ethmoidal artery and the posterior ethmoidal artery. So these are going to be the majority of the arterial supply of the nasal cavity. So then we have our sphenopalatine artery, which is the largest vessel actually supplying the nasal cavity, and that one's actually a branch of the maxillary artery, and it's found in the pterygopalatine fossa. It enters the nasal cavity by passing medially through the phenopalatine foramen and into the lateral wall of the nasal cavity. Our sphenopalatine artery then has posterior lateral nasal branches, which are going to supply a large part of the lateral wall and actually anestosome anteriorly with the branches from the anterior and posterior ethmoidal arteries, as well as the lateral nasal branch of the facial artery. Then we have our posterior septal branches of the sphenopalatine artery. Now these guys, so our posterior septal branches, they're going to pass over the roof of the cavity and onto the nasal septum. And then we're going to have our nasal palatine artery, which is actually the largest branch, and it supplies the palatal, gingival, and mucosa from the central incisor to the canine, and it will continue inferiorly to anestosome with the septal branches of the superior lateral artery around here. Then we have our facial artery. Our facial artery is going to have a septal branch, also called the superior labial artery, which originates near the lateral end of the oral fissure, and it supplies the anterior nasal septum. Our facial artery will also have a lateral nasal branch, which originates at the margin of the external nose and continues to supply blood of the external nose, including the alar branch, which passes around the lateral margin of the ala and supplies the nasal vestibule. Then we have, in more detail, our anterior ethmoidal artery, which originates actually from the orbit of the ophthalmic artery via the internal carotid artery, as I talked about earlier, and it enters the roof of the nasal cavity via a foramen that's actually lateral to the crista galli, and it gives rise to the medial or septal and lateral wall nasal branches, and they terminate by passing between the nasal bones and the lateral nasal cartilage as the external nasal artery, and this is going to supply the external aspect of the dorsum and ala of the nose. Our posterior ethmoidal artery, which we talked about, is originating from the orbit, specifically coming from the ophthalmic artery. It descends into the nasal cavity through the cribriform plate and gives branches to the upper parts of the medial and lateral nasal walls. Then we have our venous drainage. Our venous drainage essentially follows the arterial branches that originate from the maxillary artery, and they drain into the pterygoid plexus in the infratemporal fossa. The veins from the anterior and inferior regions of the nasal cavities drain into the facial vein. And in some individuals, there may actually be communication between the superior nasal cavity and the superior sagittal sinus through the foramen cecum, through the emissary vein. And the veins that accompany the anterior and posterior ethmoidal arteries are actually part of the superior ophthalmic vein, which will have drainage into the cavernous sinus via the superior orbital fissure.